going through mental health challenges, particularly with a minor child, is incredibly stressful, incredibly emotionally challenging, and it's like a roller coaster ride. And so, one of the things that's critical for, again, one or both of the parents to focus on is acting as a kind of a stabilizing influence during this emotional turbulence.
Welcome to the Company of Dads podcast. After 120 plus episodes, we're doing something different this season. I'm still your host, Paul Sullivan, and we're still focused on lead dads, working moms, and how small changes at home or work can have a big impact on their lives. What's new is each episode now promises to deliver actionable advice on some area of concern at home or at work. Short, direct, again, actionable. 5 questions, 5 answers. Our guest today is Mike Hermus. We're going to talk to him about youth mental health. He's the founder of HaleSpring, which offers a HIPAA-compliant platform designed to connect mental health care providers and patients. He's had quite a career in technology, from software companies and entrepreneurial ventures to the wildly popular but short-lived house party app to the Department of Homeland Security. He's the father of 2 teenage kids and lives in Southern Connecticut. Welcome, Mike, to the Company of Dads podcast.
Thanks for having me.
You know, being an entrepreneur is not easy. It's time consuming. It's not meant for everyone. You have, crazy, short deadlines that you wouldn't have at a larger company. For you as a dad of 2, how did you combine your passion to be an entrepreneur with certainly your desire to be a good dad?
It's a great question. And I think, look, it's a challenge for any parent, mother or father, who has any kind of demanding job. I think whether it's a startup or not, to kind of be present for their kids. I guess you could say it's probably a challenge for any parent, even if they don't have a demanding job. There's so many things as adults that distract us and pull us away from being with our children, right? And I wish I could say I had it completely figured out. I can only say I tried the best I could, and some of the things that I did, I hope worked. Look, one thing that can be a real hardship is anytime you have to travel away from home, right? And as an entrepreneur, that can be frequent. Again, in other jobs, that can be frequent. In fact, I would say where that was most difficult for me was when I was at Homeland Security, and I was away every week, the whole work week, for years, for several years on end, and that was really challenging.
And you were in DC for that. So
I was in DC, right?
Yeah.
Now we still lived in Southern Connecticut, and in that situation, right, the best, what I arrived at, which I think is, I guess, common sense, but when you're away, you of course can use technology to try to stay connected, but it's very hard if you're out and busy and doing things. When you're home, you have to really make that time count, right? You have to really try to make the home time focused on being with the family, and of course, that's not easier said than done because presumably there are several people that need quality time from you, but really try to focus on activities that can create bonds and memories, laughter, and that's what I did. So when I was home, we would really try to focus on those things, and I try to just keep in mind when I'm home, this is my number one mission at home, is to be able to spend time with the family. If you work from home, on the other hand, which I do now currently as an entrepreneur, a lot of entrepreneurs probably do these days, you can sometimes have the opposite problem, right? Like you're home all the time, but you're also never away from the office. And so there's always one last thing to do. And the laptop is just right over there. So of course, I think defining some boundaries for your work life and some space and some time to really focus on family is important. But another thing I really like to focus on, and this changes as the age of the children changes, obviously, but is really meeting them where they are, right? So, rather than trying to do things that I want to do in my free time, I try to find things I know that the kids want to do, even if it's not my preferred activity, and spend some time with them there. And like, for example, my youngest child really enjoys watching some Netflix shows that wouldn't be my preference, but we can watch them together, and then we have something to bond over. And my oldest child likes to go to the bookstore and get coffee afterwards, and so that's kind of a ritual outing for us. And those things really, really help.
Because when you're watching those, Netflix shows, you're like, wait a second, I worked at Homeland Security. That's not really how it is. Right?
On occasion.
I got to ask you this before we get on to the second question here. When you work in a senior role at the Department of Homeland Security, do you get something above like TSA pre or something above Homeland Security to get through the airport? Do you have
You
like a
know,
special badge or a wave or anything like that?
you know what, I wish. The reality is that one of the things that most people who work outside the government don't know about it is there are very few perks for working in the government unless you're like at some super senior level. In fact, it's mostly anti perks. We did get free TSA pre-check for having, if you had a top secret clearance and you worked at the Department of Homeland Security, we didn't have to pay for TSA. That was the best perk that I got.
All right. All right. That's good. That's fair enough. I mean, because when we travel, we get the global entry, we got the clear, it's all about getting through as quickly as you can.
That's right. Yeah, we no shortcuts, no shortcuts. Have to wait in the same lines as everyone else.
Oh man. Question two, again, like as I said in the intro, you've had quite a career doing all kinds of different things in the technology space. What made you pivot into mental health and create what is now HaleSpring?
Yeah, that's another good question. So I think, look, you can probably, if you take a look at my background, it may or may not be apparent, but I've always been most attracted to roles and organizations that have a mission of some kind other than just making money. Even in my first startup was actually in the financial services space, which most folks don't associate with mission-based, organizations. But our goal was to actually democratize the after-hours trading field and let retail investors trade after hours where previously only institutions could have. And that was important to me, that we were trying to do something to really level the playing field. I worked in a company that brought environmental health and safety solutions to corporations, right? And ostensibly through that could help potentially make the environment better. So I've always kind of been attracted, like many people, I'm sure, to things where I can use my skills and experience to make an impact, to make a difference in the world. And because the need for software technology is kind of ubiquitous today, I'm pretty fortunate that, that my skills can really be applied to almost any domain. And of course, I also like challenges like many folks. And while large organizations, all sorts of organizations have their own challenges, for example, at the Department of Homeland Security, trying to bring change to an organization that large and bureaucratic is incredibly difficult and requires a whole set of skills that, are really challenging. And I enjoyed that immensely. It was very satisfying. Building something from scratch, right? Creating something from nothing is in many ways the ultimate challenge for some people and for me. And I think I've always been a builder at core in my DNA, and that's why startups have always attracted me. And so, given some of the personal experience I've had in the mental health space, and I will probably talk a bit more about that later. When the opportunity came for me to kind of consider what was next, it seemed like an easy decision to try to make an impact in this space. An easy decision, not an easy path necessarily, but there's something immensely compelling about using personal struggles to try to build something that can make life better for other people.
Yeah, and what exactly, to break it down in four sentences, what exactly does HaleSpring do? How does it make that connection between the mental health care provider and the potential patient?
Yeah, so I don't know. I'll try my best to break it down into four sentences. But specifically, look, there are a couple problems we're trying to solve. One of them you mentioned, which is the connection between the provider and the patients, and we're trying to solve that by creating a richer, more comprehensive resource, database, if you will, of not just individual providers, but also other kinds of programs and provider and treatment options that are really, really hard to find on today's internet. And so,
for example,
intensive outpatient programs or residential programs or even group therapy programs, all of which are really important if you have challenges that are beyond the kind of, individual therapy needs, but are really, really hard to find right now. So one of the things that you'll hear talked about in mental health circles is the patient provider fit. And you have to have a good fit between the patient and the provider in order to get better outcomes. Because if that fit's not there, the treatment doesn't work. And so, unfortunately, for most folks, we're limited to getting whatever therapy is proximate to us, or someone told us about, or has an open slot. But our thesis is the more the liquid, transparent the marketplace is of providers and services, the better that patient-provider fit can become. And so we're aiming to try to improve that. So that's problem one that we're trying to solve. The other, which is kind of not directly related to patients and providers, is really more about how providers deliver therapy or deliver services, is the fact that there's an incredible void in communication and collaboration. So we're trying to improve the way that providers communicate and collaborate with each other in order to improve the outcomes they can deliver in mental health treatment.
I've read a lot about this, and I'm not sure if the data is accurate, but is it true that there is a dearth of mental health care providers in this country? There's sort of, COVID, we talk about post-COVID, people are sort of coming to terms with their mental health and trying to help. But is there, what is the supply and demand equation around mental health care providers and that mental health care need?
Yeah, I think the answer is there absolutely is a supply demand imbalance, and there is a dearth of providers. Exactly what the data says is harder to suss out because there's how many providers are available, there's how many people can pay for that, there's access to insurance and resources to pay for it. But by most estimates, less than half of the people who need mental health treatment get mental health treatment, and a big part of that is because of the supply demand imbalance.
Question 3, I alluded to it there. Mental health is so important. It's starting to get, more support. People are able to talk about it more openly, but there's still, taboos, around it, unfortunately. What role can a dad play in supporting, mental health for themselves, for their families, for their children? What's that role that the dad has in this?
It's an interesting area because, of course, all families and family dynamics are unique, and of course, as you probably know better than anyone, right, traditional gender roles have and are continuing to evolve, right? But in my experience, mothers are more likely to be the emotional caretakers of the children in many households, and they're therefore kind of square in the crosshairs, front and center for any children that are experiencing mental health challenges, which often involve emotional issues, emotional dysregulation of some kind. And it also happens that mental health is a uniquely female dominated field. By most estimates, around 70% of providers and mental health providers, therapists are women. With all this as context, right, I think there are a number of things that fathers can and should play a significant role in. And a major caveat here, because I don't want to step on any landmines, is that these suggestions are not intended to apply that mothers can or shouldn't do these things equally well. In many cases, they can. And in fact, I guess my point would be that at least one parent should be focused on a few of the things that I'm going to mention here. Going through mental health challenges, particularly with a minor child, is incredibly stressful, incredibly emotionally challenging, and it's like a roller coaster ride. And so one of the things that's critical for, again, one or both of the parents to focus on is acting as a kind of a stabilizing influence during this emotional turbulence. And that doesn't mean telling everybody to calm down and just simmer down. It means, right, understanding that it's an emotional time and kind of trying to remain calm as much as possible, helping to, be that rock, be that shoulder to lean on, and help the family and arrive at the right decisions while you're navigating a really complex and stressful situation. And I think that's critical. Like I said, that may be a role that some fathers feel comfortable playing.
Yeah.
Another kind of corollary similar to that is really being a good listener, right? And this is something that I think many fathers, many men in general, have to kind of work at a little bit. I know for myself personally, I always like to jump right into here's the solution. Here's how we solve the problem, right? But particularly when it comes to mental health challenges, that doesn't often work very well. And in fact, in many cases, you have to actually simply validate the problems, the challenges, the feelings, the emotions that your child is going through without trying to fix it. And that's really hard. And it's really hard for a lot of people, and it's really hard for a lot of dads. But doing that is really important, because if you try to fix the problem, it can, without doing that, it can be counterproductive. Sometimes you can get them to ask for that help, that guidance to solving the problem. And that's when it can be really productive to do. Another thing that I found is really helpful, and again can be a comfortable task for dads, is really helping with the research and analysis of treatment options, because there's so much conflicting information out there. Again, it's one of the things we're trying to help make better, but the information is fragmented. What you can find is often conflicting, like I said. And of course, it's an incredibly important decision to make. And so sifting through that, figuring out what's what is really important task.
Yeah, thank you. Question 4. You sort of alluded to having, a personal journey as a parent around, teenage mental health. I don't want to ask you to share more than you want to, but when you think about your own journey, what did you learn in terms of what, a parent can do to support their child and that child's, mental health journey? Both, the things that may have worked, and perhaps the things that, parents may want to, stay away from.
Yeah, absolutely. I mean, and look, I'm happy to share a little bit about my journey, because I think that's core to why I'm doing what I'm doing, which is, one of my children, one of our children started to encounter real mental health challenges right around middle school, at the beginning of middle school, actually. Could have been earlier, but we didn't pick up on it, which is actually, another challenge, right? And without going into too many details, this led to a years long period of trying to understand these issues, and of course, navigate and get the right treatment, which, as I mentioned before, can be incredibly stressful and emotional depending on the severity of the issues. And that makes it a really hard time, the worst time to be making kind of learning and making, trying to evaluate complex information and make really important decisions when you're under duress. And so what we learned, what I learned through that, is several things, and a couple that led to directly to like I said, the founding of HaleSpring. We found that a lot of things in the ecosystem are not working the way they probably should. They're kind of broken. And, a couple of them we already alluded to. One is it's really hard to find the right treatment. And two is that there's a really staggering lack of communication and collaboration between providers when they're delivering treatment to your child that would ultimately be beneficial if it happened properly. So one of the things that, you as a parent can do, I think, a few things I mentioned earlier, right? As a father's role, remaining calm and level-headed, being a good listener, doing good research. One thing that we found really, really important, and again, every situation is different, but I know it was difficult for us, and I know it can be difficult for a lot of parents at the beginning, is that you often come to this early conclusion that whatever the challenge your child is experiencing emotionally, with behavior, with attitude, whatever it is, that they can probably just change it if they just try hard enough, right? It's just, it's like they're misbehaving, something's going wrong. Well, just don't do that. Right. And unfortunately, this is rarely the case when it comes to mental health issues, and treating your child as if that is the case can be really, really counterproductive. Many times when you're dealing with minor children, there's going to be some sort of family or parent therapy involved in the treatment, and trying to understand your child's diagnosis and not simply wish it away is really, really critical in order to help support their treatment in the most effective way. There's a well-established treatment technique that's used for a lot of things these days called DBT, or dialectical behavior therapy. And it has a lot of really good practical techniques for both parents and kids dealing with issues. But one of the things they teach is called radical acceptance. And it basically means accepting the present moment, even when it's difficult or painful, and not just trying to avoid it. That's critical to kind of understand as you're dealing with these things, because if you can't do that, if you can't accept reality, it's really hard to change it and to improve it, right? And so that's critical. They do also really stress the importance of validation, like I mentioned earlier, validating your feelings and your experiences of your child. But I think the thing that I find the most helpful to remember, is that, and this also comes from DBT, is that remember your child is probably doing the best they can at any given moment. But that doesn't mean that they don't need to get better. They don't need to improve, and they probably want to improve. They just don't know how to without help.
Yeah.
So it's really important.
This has been wonderful, Mike. Question 5. You've gone through a lot of things. You're creating a platform. You've sort of listed, what parents can do. But, listening to this, I can imagine for a parent at the beginning of a journey, whether the child is 10, 15, 20, 25, whatever, it could seem overwhelming, or could seem the sense of like, where do I even start? Is this am I right? Am I wrong? What do I do here? If you could think of just, a few things, a few tips that you could give, those parents at the beginning of the journey where they suspect that their child needs more support around his or her mental health, what would those tips be that you give to those parents just starting out?
Yeah, I think that most important thing would be ask for help wherever you can find it in the early days, right? Like don't try to keep this. There's a very good chance that people either in your family or friends, have gone through something close to or similar to what you're going through, because this is prevalent, and you can learn so much from others, that can set you on a better path earlier and help you avoid mistakes. As you mentioned previously, there is a stigma and a challenge in talking about this kind of thing, which is really unfortunate, because it then inhibits conversations like that from happening.
Yeah.
But I would say probably the most important thing is, don't be afraid to talk to people about what you're experiencing, because you never know who is going to have really, really useful, and helpful advice, or a resource, or an actual treatment option that you wouldn't have encountered either, without that. And so, don't be afraid to have that conversation and keep an open mind. Of course, you have to learn and ask questions, right? You have to, as I mentioned earlier, you have to understand what's going on. And it's not easy to do, because sometimes, even with extended therapy and other treatments, there's not a clear reason, rationale, diagnosis for what's going on with your child, and that can be really challenging. But keeping an open mind to learning and understanding, and again, accepting that there's something that has to be improved and worked on here, is critical, because again, that allows you to use whatever skills, resources you have at your disposal, and apply them in the right direction. Because if you don't understand what the problem is, you can't solve it, right? So I think those are some of the most important things that I would say at the early stages of a journey like this. And ask those questions, be open, but also be skeptical. You have to be, just like in traditional healthcare, where you have to be an advocate for yourself or for your child, because most medical professionals are well-meaning and competent folks. They're all just human. And so you at the end of the day are the person that cares the most about your child's well-being, and you have to advocate for them.
As a sort of follow on to that last question, I'm listening to this. You have two kids. I have three kids. Many people have more than one child. When you're the parent, and as a parent, I'm always saying stuff like, fair doesn't mean equal. Like, just because you got an ice cream today doesn't mean, your sister gets an ice cream. We'll it all work out. But when it comes to something like this, when it's just, as you talk about, it's this journey, this mental health journey, what advice do you give to parents to make sure that that they're equitable, that they perhaps they definitely will need to spend more time with this one child, but what do they do with the other children that they have, so those children don't feel left out, forgotten, any number of negative things?
It is a really great point, and a big challenge, and it's a challenge that we experienced in our family for sure. And there's, at the end of the day, you're unlikely to balance it out completely, right? Particularly if it's a significant issue, because it does take up so much emotional, bandwidth, if you will, as well as other kinds of bandwidth, right? Possibly financial and others. But just like, when I mentioned earlier about trying to be present for your kids and making space and time and making time count, I would say the same thing goes here, which is trying to maybe emphasize quality over quantity, for another child or children that maybe aren't the focus at that particular time, which is simply remembering that they are equally important, if not getting equal amounts of attention and treatment. It goes a very, very long way, and trying to do something special every now and again to spend time with them and to focus on them, I think goes a really long way, even if it's not equal in time and everything else. I think that can really help.
Mike Hermus, father of two, founder of HaleSpring, which is connecting mental health providers with patients. Thank you so much for being my guest today on the Company of Dads podcast.
Paul, for having me. It was really great.
Thank you for listening to the Company of Dads podcast. I also want to thank the people who make this podcast and everything else that we do at the Company of Dads possible. Helder Mira, who is our audio producer. Lindsay Decker, who handles all of our social media. Terry Brennan, who's helping us with the newsletter and audience acquisition. Emily Servin, who is our web maestro. And of course, Evan Roosevelt, who is working side by side with me in many of the things that we do here at the Company of Dads. It's a great team, and we're just trying to bring you the best in fatherhood. Remember, the one-stop shop for everything is our newsletter, The Dad. Sign up at thecompanyofdads.com/thedad. Thank you again for listening.